for inviting me to speak, and I'm really excited to speak about skin cancer, which may not sound like the most interesting subject for some people, but actually there's a lot that you can learn, and I think that the more knowledge people have, then the less scary certain things are. So I will just progress here and be patient, because all these little buttons are cool. Okay, so I think you probably can recognize each of those three handsome men up there. And I just wanted to make a couple points about skin cancer. And skin cancer is the most common form of skin cancer, cancer. Forget cancer. When you combine the incidence of breast cancer, colon, prostate, and lung cancer combined, there's still more skin cancer each year than there is all of those combined. So you can see that it's a very high number. And each of these three gentlemen have had skin cancers, and they also look a little bit weathery, some damaged a bit too. And so 20% of Americans are going to develop a skin cancer in their lifetime, which is pretty high. And I don't know how many of you can raise your hand if you feel comfortable, but you don't need to. How many of you have had a skin cancer or know someone who's had a skin cancer? So I think that's more than 20%, and I have to raise my hand too, actually. So yes, so it's very common. And so there's three main types of skin cancer. I think Dr. Strott's going to speak about a couple other less common forms, but basal cell carcinoma makes up 80% of all skin cancers. Squamous cell carcinoma, 16%, and those two together are called non-melanoma skin cancer. So 96% of all skin cancers are non-melanoma skin cancers. That's a good thing. Why? Because most people don't die from those. So 4% of skin cancers are melanoma, but you can see that they do account for most skin cancer deaths. And often when patients come in, I ask them, do you have a family history of skin cancer? A lot of people say, oh yeah, my mom had a melanoma, or my dad had a melanoma, and my sister did too. But if you ask further, a lot of people think that melanoma, all skin cancers are melanoma, so that isn't true. All melanomas are skin cancer, but most skin cancers are not melanoma. So here's a little pie graph showing that. Thank you, Shana. So you can see vast majority basal cell skin cancer. Only a few are melanomas, and squamous cells are somewhere in the middle there. Only tipped more toward the basal cell. And so what does a basal cell carcinoma or basal cell skin cancer look like? A basal cell skin cancer will look like a little clear mole, or it can look like a little red spot, or it may look like a little scar. It doesn't really look like very much of anything. And a lot of times people will come in and say, how long have you had this? And, oh, I don't know, is it growing maybe? And has it ever bled? And if something is bled or it looks shiny, then I am concerned, and I would probably recommend a biopsy. So you can see here there's a picture of a mole at the top and a basal cell carcinoma next to it. And they look pretty close, you know, they don't look all that different. But a couple things that you can notice that are different is the basal cell is a little bit shinier. It has more red, more dilated blood vessels, and using some magnification devices often, you can get a pretty good idea just looking at the skin that might be a basal cell. So they typically don't hurt, they're slow growing, and most of the time they are non-fatal. So here's a picture of several pictures of some basal cells. So you can see the gentleman in the top, whatever side that is for you, left. Shiny red, right close to his eye there. And then right below him, there's another one. So that's classic, that red. We talk about red, pearly, telangiectasias, shiny. So that little growth has all of those features. Then the person's nose is just red there. That is probably a superficial basal cell. Doesn't look like much, but yet it is actually a skin cancer. And then the young woman with her temple right there, that's a pigmented basal cell. So it looks sort of like a mole, a little bit bigger than it should be, probably has bled now and then. So that's another picture of a basal cell skin cancer. So now squamous cell skin cancers, and I apologize if these are gross out pictures, that's not my intent. But if you do become alarmed inside of a full skin check, that might be a good idea. So squamous cell skin cancers, they look like crazy bad warts on a rampage. So you can see this growth on the person's lip. it's it's raised, it's nodular, it's not very symmetrical, it looks a little bit uneven, and often they can be sort of hard, kind of wart-like, but not just a regular wart. They look a little bit different, a little bit less organized. And they can often, there's another form that can erupt rapidly. You could have a spot on your arm or nothing, and a few weeks later you get this big sort of volcano thing on your arm, and that's called a keratoacanthoma. That's a form of squamous cell. What are actinic keratoses? Actinic keratoses are little rough flaky areas on your skin that can take months to develop. They may come, they may go, but they can potentially turn into squamous cell skin cancers. So these are precancerous growths that are caused by sun exposure. So common places for squamous cell: head, neck, hands, ears, back of the neck. I think you mentioned that too. And squamous cells are a little bit more concerning because if left untreated or if they're aggressive growth pattern, they can potentially metastasize. And here's some beautiful pictures. So we have one on the lip there, one on the back of the hand, and then one on someone's forehead. The lower picture looks like the keratoacanthoma type. So you see sort of this warty volcano that's growing. And that's a pretty good idea that that's going to be a squamous cell skin cancer. So the scary one is melanoma. And melanoma has certain classic features, but then there's always the outliers. And I guess when I go to orchard nursery and look for plants that the deers won't eat, they'll have a long list of plants you can buy for your deer, so that for your garden, so the deer don't eat it. At the bottom it says, but remember, deer don't read, so they might eat something. Same thing with melanomas. Melanomas don't read. So I'll go through the classic things that you look for with the melanoma, but people beware. If something's changing or new or just doesn't look right to you, it's a good idea to have it checked, because sometimes a little tiny growth can be something that's turning into a melanoma. So typically a melanoma will be, A, B, C, D, E. Melanoma can be asymmetrical, so it doesn't look very organized. It's just kind of weird, funky shape, irregular borders or hazy borders. There can be multiple colors on a melanoma. The diameter is usually 6 millimeters or more. Sorry, not less. Benign moles are less. And 6 millimeters is about a pencil eraser or 1/4 of an inch. So if something's bigger than that, you worry about that being a melanoma. And then a melanoma can be evolving. So evolving basically covers everything else. Evolving is new. Evolving is itching or bleeding. Evolving is changing. Evolving is growing. Evolving may be itching, but itching doesn't always mean skin cancer, fortunately. So of those 5, A, B, C, D, E, the most important ones are asymmetry and color to keep in mind. So here we have normal and abnormal benign moles on one side and melanomas on the other. And again, you can see that the melanomas they just look different. They don't look as normal. They can have multiple colors, irregular borders, be larger. There can be a little bit of color over to one side, and they typically are larger than moles. So they usually occur on sun-exposed sites, and they can spread through lymphatics, and of course can unfortunately be potentially fatal. So there are several risk factors for skin cancer, and some of those we can do something about, and some of those we can't. So ultraviolet radiation, we can definitely protect with that. Fair skin, light hair and eyes, I think you have what you were given, at least in this life. Tanning beds, you can do something about that. Family history, and I'll go into that more, which is a little bit different than just the fair skin, light hair and eyes. And immunosuppression. So these are the risk factors for developing skin cancer. The most important one really is the radiation and then your skin tone. So what happens here with the ultraviolet radiation? You can see that we're protected when the ozone is working. We're protected against ultraviolet C. So it's ultraviolet B and ultraviolet A rays that come down through the atmosphere and hit our skin. and ultraviolet B rays don't penetrate as deeply as the ultraviolet A rays do. And historically, people would say that it's the ultraviolet B rays that cause skin cancers, and the A rays aren't as worrisome. And that's the line that people working in tanning bed companies tell people that, oh, the B rays are bad and the A rays are harmless.